This patient was referred to me 6 months ago for endodontic treatment of tooth number 14. Porcelain crown on the tooth, and take a look. Look at this large periapical lucency associated with the palatal root. Look how big that lucency is. Huge. All right. This is another angulation of the tooth, and you can see the large periapical lucency here, and also another one associated with the distal buccal root. Again, you can see the large periapical lucency here. All right, so also take a look. There was a large buccal parielis and sinus tract associated with the tooth also. That's tooth number 14. Large buccal parielis and sinus tract associated with the tooth. So we discussed options with the patient. Patient wanted to try to see if tooth could be saved. And that's what we did. Went through the porcelain crown and did the root canal in one appointment. Take a look. This was immediately after the root canal was done. Again, you can see the large periapical lucency there associated with the palatal root. Look how huge that was. And here's the date, by the way, as you can see, 6 months ago when we did this root canal for this patient in one appointment. The apical diameter of the palatal canal was over 50, so I placed an MTA plug followed by gutta percha and sealer. Now take a look here. I had two complications with this tooth that I was kind of concerned about. One is I use injection technique of gutta percha, and sometimes I get some gutta percha extruded out of the canal. Look at that. That's gutta percha that was extruded, of course, unintentionally out of the canal. And you can see the loop of the gutta percha as I use the injection technique. This is MTA, as I said. And look at the mesial. My mesial, I use the injection technique of gutta percha, and you can see the periapical lucency on the mesial also. You see that right there. So I used the injection technique, and I didn't get a good fill. The gutta percha didn't penetrate as I wanted it to, all the way to my working length, as you can see. Again, you can see the periapical lucency. You can see the extruded gutta percha here. My MTA short, maybe. The other thing, again, you can see the short fill, but then again, you can see the sealer. You can see the multiple portals of exit. The other thing is that I found the MB1, MB2, and I also found an MB3, but I couldn't get it instrumented any further than this. You can see right there. So I got the MB1, I got the MB2. Let me see if I got the MB1, I got the MB2. The MB3, I could not get it any further than that. You can see that right there. I could not get it any further than that. It just would not go. I couldn't instrument it any further. You can see the MB1 and the MB2 right there, they join. You can see the multiple portals of exit and the periapical lucency there. But so that was another issue that I was concerned about. So that the underfilling of the mesial canals, the overextended gutta percha there, perhaps maybe my MTA didn't go all the way to working length as much as I wanted it. But again, you can see that large periapical lucency there. Yeah, how big that was. And again, that was immediately after we went through the crown and did this root canal for this patient in one appointment. So I asked the patient, please come back to see me in 6 months so we can do a post-op check of your tooth, and he agreed. Usually they don't show up. Usually they show up only if there's a problem, but in this case he actually showed up today just now. And again, you can see the buccal parielis and sinus tract that was associated with tooth number 14 when we went ahead and did the root canal. Again, we did the root canal in one appointment. You can see that's the date right there, 6 months ago. All right, so patient came in today, so we can do a post-op, 6 months post-op of the tooth, and take a look. Remember that huge periapical lucency? What happened to it? Healed completely. Look at remember the periapical lucency that was associated with the MB root? Healed completely. The overextended gutta percha is still there, not bothering anyone. That's another angulation. Remember, there was some periapical lucency. Actually, not slight. There was a big periapical lucency associated with the distal buccal canal. Let me show you again. Almost completely healed. Let me show you again. That was it. See? That big periapical lucency right there, associated with the distal buccal root before we did the root canal. Remember, right here. You don't need to remember it. I'm showing it to you. This was before we did the root canal. Look at it right there. And look at it today. And here's the date. As you can see, today, 6 months post-op. Patient has some perio right here. You can see because of years of food compaction between number 14 and 15. And I went over all of that with the patient before. That has nothing to do with me. I'm talking about the root canal. The patient is under the care of his dentist and a periodontist for this. Remember that huge periapical lucency associated with the palatal root? Healed completely. Remember the periapical lucency associated with the MB root? Healed completely. So, overextended gutta percha. Again, here's the date, as you can see. Overextended gutta percha doesn't affect the outcome of endodontic treatment. Multiple studies have shown that. Dr. Lin is one of those studies. Dr. Lin, author. If my MTA was short, didn't affect the outcome. We can see the large periapical lucency healed completely. My under obturation didn't cause endodontic failure. As a matter of fact, the periapical lucency that was associated with the MB root healed completely. I did this root canal in one appointment endodontic treatment. As you can see, one appointment endodontic treatment works. Here's another example. And take a look here. That was today. Remember that large buccal parielis and sinus tract? Gone. And that's, as you can see, today. That's the date. Healed, gone, completely. Patient has zero symptoms, no symptoms whatsoever. Still has the same crown that I went through 6 months ago. The endo axis is restored with composite by his dentist. And here it is. 6 months post-op of tooth number 14. Tooth is in full function, asymptomatic, patient is happy. So, the extent of obturation has no effect on the outcome of endodontics, Dr. Lin's study and multiple other studies. The most important thing is to make sure that you irrigate copiously with 6% sodium hypochlorite to working length and sonic and ultrasonic activation.